is for Medicare, kind of make you understand a little bit more about it. Um, so this is Medicare and what it is. What is Medicare? Well, there's the original Medicare. It's the blue, red, and white card. You can just do that. You can do Medicare with a supplement and help you pay for what Medicare doesn't have. You can go Medicare Advantage, which is the one that is owned by private insurance companies. So you still have to pay for your Medicare, but the Advantage plan pays for pretty much everything. And then there's Part D. When you sign up, this is where you would have to go to medicare.gov, basic forms. You can also call them 1-800-Medicare. If you think somebody got a hold of your card, you definitely need to call 1-800-Medicare so that you don't get charged for somebody else's using your card. Okay, and so what is Medicare? Well, there's two parts basically. There's Part A and Part B. Part A is your inpatient skilled nursing facility, hospice care, home health care. Part B is service for doctors and other health care, outpatient, home health care, durable medical equipment, and some preventative services like certain vaccine and cancer screenings. Now, it doesn't matter if you go to me or somebody else. In some place, somebody's going to have to say, we don't offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact medicare.gov or 1-800-Medicare to get the information for all your options. And the reason why they started doing that was because there's certain insurance companies that they would only allow their people to sell one type of insurance. And so they were finding out that wasn't always the best fit for them. And so that's why they tell us we have to say that. So this is the next part is only if you're going to use Medicare. So you're going to just sign up. This is Part A. If you're hospitalized the first through 60 days, most confinement costs after the required Medicare deductible, and that deductible is 1,632 days. 61 to 90 days, all eligible expenses after patient pays a per day co-insurance. And the co-insurance can be as much as 408 days. 90 to 150 days in the hospital. All eligible expenses after patient pays per day co-insurance. So that could be up to 816 a day. 151 days or more, they don't pay anything and you pay all costs. Now, skilled nursing confinement, the eligible expenses for that Medicare will pay is the first 20 days. Then the eligible expenses for day 21 through 100 pays for per co-insurance. After 20 days, you would pay the 204 day per day co-insurance. Okay, then hospice care must meet Medicare requirements. It's all but very limited co-pays for outpatient drugs. And hospice care, Medicare pays for that. Blood, 100% approved amount after the first 3 pints. So then after that, you would pay for that. Annual deductible. Occurred by Medicare deductibles, you pay the $240. Now it's going to go up next year, but that's what you're paying right now. Medical expenses. This is for the doctor. As long as they're part of Medicare, then it's going to be 80% of the approved amount. You pay the 20%. Excess doctor's charges, you pay all the costs for that. Clinic laboratory service, generally it's 100% approved amount, and you pay for nothing. Home health care, 100% approved amount, 80% for approved amount for durable payment rates. So you would have to kind of check and see exactly what your services are going to be needed. Outpatient hospital treatment, Medicare pays the hospital based on outpatient procedure payment rates. And then you would have to do the co-insurance after that. Blood, 80% approved after the 3 pints of blood. And then you pay the 3 pints plus 20% approved amount after any additional amount. Okay, so physicians who don't accept the assignment of Medicare claims, they're limited what the amount they can charge. And in 2024, the charge they can do is 115% of the approved amount. And that might vary state by state. So you would have to kind of check to see what they're charging. You have to call the doctor. Now about Part D. If you have credible coverage, and that can be from a group, union, veteran, TRICARE, Indian Health Services, you can only go 63 days without credible coverage, or you will have to pay a penalty. And that is calculated by 6% of the 1% of the national added to your Part D. So Part D covers all the outpatient prescription drugs. Drugs that are injected and given at the doctor office, that Part B kicks in. Part D does cover like insulin and diet for diabetes. And this you can go through, and this is how much the penalty you would have to pay. Okay, so what's the pros and cons between the supplement and the Advantage plan? Well, when it comes to comparing Medicare Advantage and supplement, there is key distinctions between the two. I'm going to sneeze. I'm sorry. And then, and they both have their advantages and disadvantages. So that's what we're going to go through next. Okay, networks. The supplement, you can go to any network you want to as long as they accept Medicare. Advantage plan requires you to see the doctors and hospitals within the plan network, which can limit you seeing your preferred doctor or specialist. Copays does not require any pocket expenses such as copays. Advantage plans often requires copays and sometimes even deductibles. Premiums higher and will increase over time. Advantage plans are lower but changes every year. Referrals, you don't need them. Advantage plan usually will have to see a specialist. You usually do. Doctors and hospitals, as long as they accept Medicare, you're good to go. Advantage plan, every year you need to check and see if your doctor's still in it. So those are the big, quite of the big. Supplement, deductible, no. Advantage plan, usually. Enrollment, 6 months before your birthday and 3 months after. Advantage plan is 3 months before your birthday and 3 months after. Sign up, must have Part A and B. So with the Advantage, you must have Part A and B. Enrollment, first enrollment, guaranteed issue. After that, they can deny you. As long as it's an Advantage plan, as long as it's during open enrollment, whatever that enrollment may be, they can't deny you. Part D, you'll have to pay for it. Advantage plan, they may give you dental, vision, and more in the MD. So that is kind of what the difference between the two of them are. So you have to figure out what will fit your budget the best. So what's next? Well, I would talk to you and figure out what you're looking for. And if you have certain doctors or prescriptions, if you're planning on traveling, anything like that. And then you have to fill out a scope of appointment. Um, that doesn't mean you're going to buy insurance. What it is there's been some naughty people out there. And so CSM wants us to make sure that it's okay for us to talk with you. And so it's called a scope of appointment. Before we can talk to you about plans, we have to make sure that's signed. That's pretty much it. If you have any questions, feel free to call me or you can email me too. I'll talk to you soon. Bye.